Connected by purpose, driven by passion. Welcome to the Spark Live webinar series, where we gather to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. Children's Healthcare Canada would like to thank our funding partners for their ongoing contributions that support all of our programs and activities. Keep up to date on all of Children's Healthcare Canada's webinars, events, and announcements. Sign up for our Spark News e-bulletin by visiting our website at childhealthcan.ca and follow @childhealthcan on Instagram, X, and LinkedIn. Now, on to today's webinar.
Hello, everyone, and welcome to a Research Town Hall version of Children's Healthcare Canada's Spark Live webinars. It's a service to our members, strategic partners, and the child health research community. I'm Paula Robeson, your host for the next hour and a half. I'll begin by acknowledging that Children's Healthcare Canada operates on the traditional and unceded territory of the Algonquin Anishinaabe peoples. We recognize and deeply appreciate their historic connection to Ottawa. And today, Ottawa is home to Indigenous peoples from across Turtle Island. Children's Healthcare Canada is committed to working towards forging new and deepening existing relationships that include First Nations, Inuit, and Métis peoples, and is grateful for the opportunity to share this land as we work to measurably improve children's health outcomes from coast to coast to coast. We're delighted to host this research town hall with colleagues about building bridges, essential supports for children with disabilities and their families in schools, healthcare, and community. I would like to introduce our speakers today. Dr. Olaf Kraus de Camargo is Associate Professor of Pediatrics at McMaster University and the co-director of CanChild Center for Childhood Disability Research. Anna Swain has a background in clinical developmental psychology and is a research coordinator at CanChild. Kinga Posniak is a social cultural anthropologist and a postdoctoral researcher at CanChild. Genevieve Curry is a nursing researcher at Mount Royal University and the mother of 2 children with disabilities. Amanda Doherty Kirby is a disability advocate and mother of children with disabilities. Welcome all. It's now my pleasure to pass the mic to Olaf.
Thank you so much, Paula, for the introduction, and no worries about my name. That's why I only go by Dr. Olaf to make things easier for everyone. I'm really pleased to be able to share some of our results here today. The people that you just introduced are part of a research team based out of CanChild. CanChild is a research center for childhood onset disability at McMaster University. For the past 35 years, CanChild has been doing research to help improve the lives of children with disabilities and their families. Traditionally, much of the research done at CanChild has focused on healthcare and rehabilitation contexts, but something we are increasingly becoming aware is that children with disabilities and their family, healthcare, and education are not separate. For example, school-age children receive many therapy-related services and supports at schools. However, healthcare providers and educators rarely have adequate opportunities to come together. I had the privilege of being able to do that here in Hamilton for many years, but unfortunately, due to funding issues, this is also not possible anymore, and we might talk more about this later on. Today's town hall is inspired by one of our research studies, which really drove home the message that healthcare and education don't have enough opportunities to talk to each other, and there are good reasons why they should. Our goal for today was to bring together healthcare providers, educators, and families in the same Zoom room, share with you what we learned, and ask you to help us figure out a concrete next step for moving forward. Can I have the next slide, please? Here's a picture of our research team. And as you can see, our team has many different people. It is composed of mothers, of youth, of clinicians, education researchers, and some of us wear multiple hats. Most of our team members are here today. We will have a handful of us only to speak on behalf of the team, just because we're trying to keep the presentation tight to allow more room for the town hall discussion, which will start after the presentation in joint rooms and breakout rooms to get your perspectives more directly for us. In each of the rooms, there will be a note taker from our team to document what we discussed today. And about the next steps, I will make some comments at the end of the town hall. I will pass over now to Genevieve.
Good morning, everyone. So our study was inspired, and we're going to talk to you about it today in our town hall, and it grew out of the COVID-19 pandemic. We wanted to learn about the experience of children and families during the pandemic, with the goal to identify what supports families need to be at their best as the world rebuilds after the pandemic. So certainly COVID-19 was a jumping off point, but we're aware that children's and parents' accounts were occurring before COVID, and they're still there now. We wanted to develop a study that would be actually fun for kids and youth to participate in, and a study that would be flexible so that children and youth who wanted to participate had the opportunity to participate. Together with youth on our study, we co-designed a worksheet called the COVID Time Capsule, which you can see here on the screen, which is a form-fillable worksheet that asks kids to draw or copy or paste images to tell us about different things in their life. So fitness, school, friends, family, fun, and future. And you might recognize these F words from the CanChild researchers from child development. And I know I saw Dr. Peter Rosenbaum in the audience, and so this is certainly his work. And these F words came from the World Health Organization's ICF framework, the International Classification of Functioning, Disability, and Health. And they describe the various domains of life that influence health. So we asked kids and youth to complete the COVID Time Capsule worksheet with pictures, drawings, or images. Then we met with them on Zoom and talked about their pictures. And then we also met with parents separately and talked with them about their experiences. So we started out having youth complete the time capsules on their own, and we had 18 youth complete the time capsules. Then we interviewed the parents, and so we had 18 youth and 14 caregivers because 4 families had more than one child that participated in the study. The interviews gave us insights, which we're going to share some of those here in a little bit. And families talked about what their experiences were like and what their needs were moving forward. Based on these interviews, we designed a questionnaire to help us get some numbers behind the stories and also identify the supports that were most important to families and what the key gaps were. At this point, we are analyzing the data from the surveys. We are in the process of sharing what we are learning and thinking about with actionable next steps. And today's event is part of sharing and planning those steps. I'll just turn it over to Anya now.
Thank you and welcome everyone. So we invited you here today, of course, to share our key learnings, because it's hard to have a discussion without them. But in those learnings, our goal is to highlight the connections between healthcare and education in the lives of children with disabilities and their families, and identify shared challenges across healthcare and education, because as you will see in the next slides, there's a huge overlap that impacts lives of families when those very important sectors don't communicate across each other. And during the discussion, we hope with all of you to explore strategies to bridge this gap in communication and collaboration, and hopefully identify the first tangible steps. So in the next few slides, we'll quickly share what we've learned. You can see on the screen the examples of some of the time capsule images that children shared with us. And one thing that we quickly realized when we looked at all the pictures, and that kids, like we asked to represent in the time capsule different domains of their lives, like fun, friends, fitness, learning, family. And the pictures and stories show that all those different domains overlap and they affect each other. For example, it's expected that children have fun at school with their friends, or when they play sports together, they also do it with their friends. Some children took part in extracurricular activities at school, such as playing school sports or belonging to drama, music, or dance clubs. And again, while it's pretty natural and expected for children to share those experiences, when we think about children with disabilities, who might need some extra additional support or extra opportunities to be able to participate, they not only miss on one domain, they might miss or lose opportunity to interact with friends or have fun or engage in fitness and lose out much more at the end. Families also provided us with suggestions what they need to try, and the needs they identified can be organized in few big picture themes that we'll discuss in the next slides. And those themes cut across different sectors, including healthcare, education, recreation, and so on. And of course, the details are different depending on the context. But these ideas, these issues that families talk about are constant. And we will give you a quick overview of those big picture ideas and how these issues play a role and play out in different contexts.
Okay, so the first big picture issue that kept coming up is the need for flexibility in programs and supports. We often heard that supports, whether they are in education or healthcare or respite or funding programs, are too rigid and based on a cookie cutter approach. In effect, the kids and families who don't fit into the box end up slipping through the cracks. So for example, in the context of community-based programs, we heard about children being denied access to programs or therapies because they were quote unquote too disabled or not disabled enough, or didn't have the right diagnosis. In the context of schools, we heard stories about children being denied access to certain resources, for example, like a sensory room at school, because they were not officially enrolled in a certain program, and only kids from that particular program were allowed access. Or we heard about children not receiving certain services because those services were tied to funding pools in one particular sector and couldn't, cross sectors, right? So let's say we had one example of a child who needed speech therapy, but the school speech therapist was not allowed to work on language goals, only articulation goals. However, this child had language goals that had to be addressed first before the articulation goals. So what happened in the end was just they didn't end up getting speech at school at all. We also heard the opposite problem of therapists in the community who are not allowed to work on goals that are deemed to be school goals. And we are going to read you one mother's quote describing that issue.
Even if you get the funding, you can use it, but it strictly has to be used for home and community-based things. You have to be very careful that what your SLP and OT are working on doesn't wade into basically education purposes.
Okay, another huge theme was just how important it is for kids to have meaningful relationships with others, and that these connections need to be consistent and reliable. Lots of kids talked about and included pictures of various important people in their lives, which to us really spoke to how important it is to have a circle of invested individuals in all sectors who click with the child, right? So that includes, teachers and EAs and coaches, therapists, doctors. So for example, families talked about certain teachers or EAs or principals who made such a difference to the child's school experience because they were willing to look for solutions out of the box, and they really made an effort to connect and build a relationship with the child. In the context of sort of healthcare and rehab, lots of kids talked about their therapists with whom they had sort of ongoing positive relationships. What's more, a few kids actually talked about looking forward to going to their hospital appointments because they liked seeing their healthcare providers. And one girl even included a picture of having her blood work done. And you can see that picture here in the middle. And that picture really spoke to me personally because I'm afraid of needles. So I feel like if there is a kid who's actually looking forward to going to the hospital to get her blood work done, then that medical team is really doing something right. On the flip side, we also heard that professionals who are not invested or not professional can really make things more challenging. So for example, we heard a story about a therapist who was questioning the child's abilities in front of the child, resulting in the child no longer wanting to work with that person. We also heard that this sort of continuity of care that families need and value so much is not easy to find, right? People change jobs, schools and organizations and agencies sort of shuffle people around based on staffing needs. In certain professions like home care, nursing, or respite care, there's a really high turnover of staff. And of course, some of that, is going to be inevitable, right? But are there any ways that we could build more continuity of care into systems, right? So that people who work in those systems want to stay, and also so that providing this consistency and continuity is actually seen as an institutional priority. Next slide, please. Okay, parents also told us that they really value the kind of care that is sort of comprehensive and coordinated and integrated and takes into account the entire picture of the family's life. We heard lots of examples of information not being relayed between healthcare providers and school staff, and sometimes even between staff at the same school or between healthcare providers at the same organization. One parent, for example, told us a story about sharing with a guidance counselor the news that her child had passed away, the child's father had passed away, which she expected would get relayed to all the relevant teachers. But that never happened. Parents also talked about sort of information about accommodations or therapies getting lost in the broken telephone, right? So as soon as, one therapist switched positions, or once the school year ended and there was a new teacher next year, right? All that legwork would have to be done from the start. On a positive note, a few parents did give us examples of coordinated and holistic supports, which sometimes came from surprising places. So for example, one mother described the summer camp that her child attended, where, as she said, everything was sort of anticipated and planned and provided, down to, water bottle, sleeping bag, pre-printed labels with the child's clothing. So the way she described it, all she had to do was just drop off her kid and she didn't need to think about it. And I will just share with you one more positive example of a mother describing the complex care program at her local hospital. And this is what she said.
Having one-stop shop for everything, like broken leg, I have an issue. I have one person I can call. I can text her right now, and she will direct me and she will advocate for me. But most families don't have that. They go to the ortho or they go to the ENT, and they're all separate entities. In my case, it's not a separate entity at all. Yes, I go to ortho, I go to ENT, but if I have an issue with either of them, I talk to complex care and then they'll sort it out. Next slide, please.
Okay, so we have sketched out kind of some big picture issues, right? The need for flexibility and continuity of care and sort of coordinated care. The thing is that when these things are not in place, it's the parents who end up filling the cracks. So they're the ones who, take on the roles of teachers and therapists and, nurses and care coordinators and advocates and so on. So this diagram here, and those of you who work in the sectors probably have seen some variants of this, because lots of parents have their own bubbles that look very similar. So this is one mom's diagram of all the different entities that she coordinates on behalf of her child, and the name is a pseudonym, obviously. And even from the way that she's created this image, you can tell that the different bubbles don't talk to each other, right? She has to be kind of the messenger between them. And next slide, please. And I just want us to hear from two other moms, kind of on the same topic, talking about the need to be sort of constantly advocating and fighting to get the children the support that they need.
I always felt like if I advocate hard enough that they'll get some supports. I'm not looking for perfection, but my kids are now in junior high, and I realize it was literally another full-time job just advocating, and what they got out of that was very, very little. And my kids got more than what most kids would get, and it's nowhere near what they need. You always have to fight. If you don't fight, you won't get anything. And you kind of have to go big to fight with the Board of Education. You can't just ask them nicely to change. You kind of have to yell and scream and be that mom, or they don't listen. Next slide, please. So we will now segue to the discussion portion of today's event so that you can have your say. If you're interested in hearing more about our work, please check out our website and our YouTube channel.
Thanks for your time today. Come back and see us again through the webinars, and let me know if you like this town hall format. Maybe we'll offer more of these. Thanks so much. Have a really great day.
Yep.
Bye, all.